know there's more advocacy to be done. So these are some of the resources I wanted to mention. And again, I can have this sent out so Jean can share this information with everybody. But since COVID, there's been some resources online for online adaptive sport or online adaptive physical activity, which is making it a lot easier for people to be able to meet the physical activity requirements from home. So I'm happy to share those resources with you guys. So then I just wanted to move, obviously we talked a lot about physical disability here, but certainly there's a lot of youth with spina bifida who also have intellectual disability. And so not only would the individuals be able to qualify for para or adaptive sports locally, but they may also be able to qualify for Special Olympics. And a lot of times it's helpful to kind of look into both organizations to see what's the best fit, or kind of do a little bit with both organizations. So Special Olympics, it's really a year-round training and athletic opportunities that are available, children and adults, and it's really there to try to help with physical fitness, and then also from a happiness perspective too, for courage and joy and really social interaction and skills and friendship. So there's so many benefits that we all have from doing things like physical activity, and certainly Special Olympics really prides itself in making sure that it's a fun, happy environment. And so when we're talking about intellectual disability, these are some of the official the official definitions of it. So essentially it's before the age of 18 that there's a disability that affects both what we call intellectual functioning and adaptive behaviors. And so when we're talking about intellectual functioning, it's usually measured by an IQ test. And, some folks may have had neuropsych testing, and so that's a good way of kind of telling or seeing if there are any impairments related to intellectual functioning. And then adaptive behaviors. So because of the intellectual disability, there may be some help that people might need, or some adaptations that they might need in order to do day-to-day activities such as taking care of themselves and communication and social skills. So Special Olympics is really the world's largest organization that dedicates to children, adolescents, and adults with intellectual disability. And it was started in 1968 by Eunice Kennedy Shriver, because her sister Rosemary Kennedy had an intellectual disability. So I love this oath. It says, "Let me win, but if I cannot win, let me be brave in the attempt." And I feel like that should be a philosophy for all of us in day-to-day life, but that's definitely the philosophy behind Special Olympics. And if you go to any Special Olympics events, sometimes you'll hear everyone kind of say the oath before the competition. And this really kind of shows us a list of all the sports that are out there. So there's tons, and they're always adding. And some of them are not necessarily official sports, but like I know locally, sometimes they have Zumba classes or yoga. And so those are also things that people may want to get involved with. And so there's been lots of benefits that have been cited. So improved sports skills, like pretty much across the board, people felt like their sports skills got a lot better when they participated. And then increased levels of self-esteem and social inclusion. So in addition, the families of athletes felt like they really thought it had a positive effect on time spent as a family. And they felt like, it just seems like it was such a joy to a lot of families that this opportunity was available. And participation positively affected the family, gives them an opportunity to have an activity that the whole family shares, and give them an experience that, to kind of make sure that there's a similar experience between siblings, right? So there may be a sibling with and without an intellectual disability, and sport can be something that really connects people together. So for participation in the traditional sports, individuals have to be at least 8 years old, have an intellectual disability, as we kind of mentioned, and then the athletes are grouped by age, gender, and ability. So again, just to level the playing field. And then everyone's given the chance to participate and perform to the best of their ability. So there's lots of different programs in the United States and so many countries around the world. And this is a pre-pandemic statistic, so I'm not sure that the number of sports competitions each day is quite as high as this states, but pre-pandemic, this is certainly how it was, and hopefully once all of this passes, we'll be getting back to doing more and more sports competitions as well. And then there's also other programs within Special Olympics that I think not a lot of people know about. So one of them is called Young Athletes, and it's for children ages 2 to 7. And this is working on a lot of developmental skills, and so like pre-sport skills as well. There's also unified sports, which I know in Massachusetts we have several high schools that do unified sports. And so it's teams that have a combination of individuals with and without an intellectual disability on the same team, and participating in sports like basketball and whatnot through the actual school, which has been a really great experience around the board. And I kind of mentioned the fact that in the Paralympics there are some categories for folks to classify basically just on the diagnosis of intellectual disability. The issue was that I think there was a little bit of difficulty confirming the diagnosis of intellectual disability. So there had been some controversy in the past about this. So it was more prevalent with the Paralympics, and then that got cut back. And now there are still a couple of sports that you can participate in if your single disability that you're trying to classify under is intellectual disability. So Paralympics and Special Olympics, as we mentioned, hopefully that's something that you guys all got away from the talk, are two very separate things, both fantastic organizations, but kind of serve different communities and different in the way that Special Olympics really runs the gamut and of novice to elite athlete. And Paralympics is really like super elite athletes who are participating in the Olympics and Paralympic Games. So a big thing that we also talk about within Special Olympics community is also inclusive health. So we know things like individuals with intellectual disability don't always necessarily get all the services and all of the healthcare that they need. And that's something, again, that I think that from an advocate standpoint, we just need to continue to advocate for, to make sure that doors are open and that it's a smooth process. And so really there was a big initiative that started in 2016 with the Special Olympics to really make sure that there's a lot of advocacy efforts to try to make sure that doctors have the resources and education that they need in order to take care of people with intellectual disabilities, and that individuals with intellectual disabilities know where to go and what things that they should be looking for too. This was actually one of the big events about this. And so I was fortunate to be at this event where actually the Surgeon General at the time spoke, and I believe he has a family member with an intellectual disability. And so it was a topic really near and dear to his heart. And it really just got together people from all different backgrounds, whether they were in medicine or they were in advocacy, or they were individuals with intellectual disability who were strong advocates too, all in the same room to try to figure out how do we progress things forward to make sure that people have the access that they need to the healthcare and fitness resources that they need. So this is a list here of all the different opportunities within what's called Healthy Athletes, which is a branch of Special Olympics that focuses really on health. So there are these events, and we do have some events within Special Olympics Massachusetts, and the one that we're going to be having soon, we were supposed to have it this year, but because of the pandemic, we had to push it off, but is MedFest, which is those pre-participation physicals, so actually having them done together so that you can go as one-stop shopping to be able to get that screening done by physicians. But right now, what we are recommending, and we do think that this is best practice, and this is a really important thing to do, is go to your primary care doctor for those check-ins, because at this point, having big group of people in one space obviously wouldn't be safe because of the pandemic. But, again, pre-pandemic, and hopefully once we come out of the pandemic mode, there are so many lots of different screening opportunities for folks throughout Special Olympics that might be fitness screenings or feet screenings or vision screenings that are offered by specialists throughout the state and region who are volunteering their time because this is something that they think is important. And so here's a link to it, but these are the forms. And so I had mentioned before that for Special Olympics, it is different forms than for adaptive sports or for general sports. And so this is kind of what they look like. And those are the forms that you'd have your doctor fill out, or if a MedFest event were to occur, that the MedFest team would fill out for you. And so when we think about sports medicine considerations for youth or adult athletes with intellectual disability, we think about the importance of hydration and nutrition, preventing environmental cold or heat stress. Because again, people might be on medications that really affect things like hydration or temperature control, sunscreen. And I think a lot about sports specialization, which essentially means that we know in the general population, I'm sure it's the same, in Special Olympics athletes and para athletes, but we don't have enough data to say for sure, is that it's healthier to participate in a lot of different types of physical activity versus doing the same thing day in and day out. Because if you do the same thing day in and day out, you might put stress on the joints that you're doing the same activity with over and over. And so there aren't many studies right now on what the injuries actually are in Special Olympic athletes. And this is something that I'm actually working with Special Olympics Incorporated on a project that we're just going to be starting out. Actually, the first meeting is going to be later this week. So what we're working on doing is actually putting together a program that would include tracking injuries throughout different Special Olympic events so that we can get a sense of making sure that we're keeping the athletes the day of safe, but then also get an idea of patterns so that we know how to prepare for medical events. And we also, so that we know how to take care of injuries, but also know how to try to prevent injuries, because then we have a better sense of what they are. Right now, it's kind of hard to say what the typical pattern of injuries are, but from at least one study that I looked at, they seem to be similar injuries as we've seen in the general population, which is muscles or bones or joints or ligaments, and then skin injuries pretty common as well. So I wanted to also, I know I put the resources for para and adaptive sport online that have really come out during the COVID-19 pandemic. And then this is information from Special Olympics Massachusetts. They do sometimes have some live online fitness classes as well, or opportunities. So those are definitely things to look out for. And again, I'll share those resources as well. So that's all I have for you guys today. Again, thank you so much for the invitation.
Thank you so much. That was a tremendous amount of information. We're really grateful to you for your expertise and certainly for your time. I did want to just remind people as well that we do have our empowerment grants available through Spina Bifida, and those would be a great way to help ease yourself, at least financially, into one of the many programs that Dr. Dubon just shared with us. So those are available to any member with Spina Bifida, up to $250 a year. So if you want to sign up for a class or try a new sport, or you need some equipment, we absolutely are here to help you with that. So I think that might be a nice supplement to some of the inspiration that you've received through this talk. So many opportunities available to people, and I think we all understand the importance of keeping our bodies moving, and what that does for both our physical and mental health, particularly in light of the times that we are living in. So I really want to say thank you so much to you for your time and for your expertise. This was a great way to kick off our speaker series, and we're very grateful to you.
Yeah, thank you guys so much.
I'm going to stop the recording.
Okay.